positive side effects and there's negative side effects. Usually we always think of side effects as negative, but actually there's quite a few positive benefits to the hormonal coil, and I want to go through those initially. So we kind of mentioned this before, but the Mirena, or the hormonal IUD, which the trade name is Mirena, can actually decrease menstrual bleeding by about 50 to 60% after the first 3 months of use. So if somebody really suffers from heavy periods, this is a great form of contraception for them because it tends to thin the endometrial lining. It can decrease the bleeding by 50 to 60% within those first 3 months. And actually, about 20% of women who use this form of contraception stop having periods altogether after about 3 months or so. So sometimes this can worry someone if they don't have monthly periods, but actually this is a very, very normal and common side effect of this form of contraception, and it's beneficial for some women, especially if they've suffered from heavy periods for the rest of their lives. It can also decrease menstrual pain. So women who suffer from things like endometriosis or very chronic pelvic pain related to their menstrual cycle, this is another reason why this is a great form of contraception, because women really describe decreased levels of pain after using this form of contraception. So again, women who suffer from endometriosis, if they suffer from fibroid pain, if they suffer from something called adenomyosis, a lot of times doctors will prescribe this as both a treatment for those, but also with contraception. So it kind of has a dual purpose for those women. So then the next thing I want to talk about is negative side effects. And I know I mentioned some of these when we were talking about the birth control pill, and a lot of these are similar. So if a woman suffers from headaches or nausea or vomiting with a birth control pill, that may be related to the estrogen component, but it also may be related to the progesterone component. So the progesterone that is present in this would also cause those same side effects. So the most common ones are headache, nausea, vomiting, breast tenderness, irregular bleeding. So sometimes, as opposed to taking your periods away completely, it'll just be really intermenstrual spotting, which is a little bit annoying for some people. So a lot of times it takes your period away completely, but if you are one of those women that just have a spot here and there, and then a couple days later it happens again, and then a week later it happens again, sometimes that unpredictable bleeding pattern can just be really frustrating for some women, and that can be a side effect of this. And then the other two are pelvic cramping or mood changes. Again, these are not common side effects with this, but they are something that you need to be aware of if you're considering this method of